Plan G versus Plan N, which is better? Hi, this is Kathy Bukowski. I'm the owner of CB Health Insurance and the CB Health Insurance YouTube channel. In today's video, we're going to answer that question. But first, don't forget to subscribe to our channel. Hit the little bell so you get future notifications when we release new videos, which is about twice a month. Don't forget to tell your family and friends and give us a thumbs up if you like this video. Now on to today's video. Plan G or Plan N? Which one is better? First of all, what are we talking about? We're talking about Medicare Supplements. Medicare Supplements, they have standardized policies. Plan G is one of them. Plan N is another. People that are enrolled in original Medicare through the government, Plan A and Plan B, can buy a supplement. And when can they do that? Well, when they first become eligible or at any time. But we're going to talk about which one is better. And not only that, but why would you consider one over the other, and who might consider one over the other? So first, I think most people will agree with this statement. Plan G is considered to be the best plan that you can buy currently. When I say currently, it covers the most benefits that you can buy. And that's for anybody that turned 65 after and became eligible for Medicare after 2020. Prior to 2020, there was a plan that was a little bit better than G called Plan F. And while it has not gone away, people that were eligible for Medicare before 2020 can still purchase it, they can still enroll in it, they can still keep that plan. Those individuals turning 65 after 2020 cannot buy Plan F, right? So Plan G is currently the best plan out there. Plan N is really a cost savings option. When we say cost savings, what does that mean? It means the premium is lower, right? So you're going to save money on the monthly premium. But, oh, by the way, it has less benefits. So let's take a look at, is the premium worth the savings? And I think in order to analyze that, we really need to take a look at what is the difference before we even look at the cost. So take a look at this.
So here we have all of the Medicare supplements, A, B, C, D, that you can buy. And you'll notice the far right-hand column, you see that in order to buy Plan C or F, you had to be eligible for Medicare prior to 2020. So I've highlighted Plan G and I've highlighted Plan N. Plan G is, quote, the best plan because it literally covers everything except, oh, by the way, it doesn't cover one thing, the Medicare Part B deductible. What is the Medicare Part B deductible? Well, it's the annual deductible that you must meet for any outpatient services before Medicare starts kicking in. The government sets this each year. For 2024, it's $240, but it does go up each year. Now, $240, if you have Plan G, is the only deductible that you have for any outpatient services. And quite frankly, this is a lot lower than many individual policies or group health insurance plans. I think on the individual market, the lowest deductible you can buy is $750. So $240 is what it currently is at. It does go up every year. Now, Plan N, we talked about, has a cost savings options, and because of that, it has less benefits. So what are the less benefits? First and foremost, it introduces some co-payments. Oh, by the way, it also does not cover the Part B deductible. So that's the same, right? Plan G and Plan N, they both have you meet that Part B deductible. But N introduces co-payments, and what are they? So let's take a look at the details here. What you would have to pay is if you see a physician for an office visit, and it can be a primary doctor, it can be a specialist, you're going to pay a $20 copay each and every time. If you end up in ER, an emergency room, now this is outpatient, you're going to pay a $50 copay at any emergency room visit. That copay will be waived if you are admitted to the hospital, right? And then Part B doesn't apply. This is your outpatient. Part A would apply. So it would be waived if you were admitted. But what we're talking about is outpatient ER. There's a $50 copay. The second thing that is different is that, there's two different copays, right? So that's 1 and 2. The third thing that is different is this excess fees. What are we talking about?
What are excess fees? excess fees are what physicians and providers, doctors and other physicians, are allowed to charge over and above the reimbursement that they get for any given procedure from the government, from Medicare. When you're on Medicare, you can go to any doctor that agrees to accept Medicare, and they're going to get reimbursed per procedure X number of dollars. The government sets it, right? They can't really negotiate. And the government does index it, so it does keep pace with inflation. But a lot of physicians get paid a lot more when you're on private insurance versus on Medicare. And so within the law, they are allowed to charge 15% over and above the reimbursement that they get from the government. It's called the excess fees. When you're on Plan G, that's paid at 100%. You don't have to worry about it. However, when you're on Plan N, that is not covered. So what you should do if you're considering Plan N is ask your physician, do you take Medicare assignment? What is Medicare assignment? That basically says, do you agree to accept the reimbursement that you're getting from the government and not balance bill me the excess fees, which is 15%. And that could really add up. So if you are considering that, you should really talk to your physician about that. Now, let's look at premiums. How much savings are we talking about? Premiums are based on a couple of things. One, your age, right? How old you are is going to vary the premium. Two, male or female, right? Typically, males are more money, unfortunately. Smoker, non-smoker. And yes, the insurance companies are allowed to charge smokers more money, and they do often. And then your zip code. Where are you located? Where do you live? So these numbers are based on Illinois. That's where I'm located. They can vary by state, and they can vary by county. This is DuPage County. I happen to do a female non-smoker, and I wanted to take a look at what is the differential between G and N at age 65, age 75, and if somebody was under 65, because those premiums are a lot higher. So what is the savings going to be? So at age 65, Plan G is around, and I checked the top carriers and I just went with the lowest cost one, and I stuck with the same carrier. So Plan G is about just under $123 a month. Plan N at age 65 is a little over $87 a month. The savings per month is $35, which equates to $422 a year, moving from G to N. That's the difference at age 65. At age 75, premium's about $159. Plan N for Plan G, Plan N is about $114. Savings about $45 a month, which is about $541 a year. Plan G to Plan N savings. Under 65, Plan G is $325 a month. Plan N is $241. Savings is $84 a month. It's over $1,000 a year savings. Wow, that's pretty big. So who would do this? Why would you do this? One, you're looking to save money, right? And two, you still want that freedom to choose any provider in the country because when you're on original Medicare, you can go to anywhere in the country. There's not a network, anybody that takes Medicare anywhere in the US. And three, you're trying to save enough money. You're analyzing, is it worth it for me to have the savings? Because, oh, by the way, I'm giving something up. So if you look at, for an example would be, let's say you go to the doctor on average 10 times a year. You see your primary doctor for an annual physical, you do a checkup, you go to the dermatologist, you might have an allergist, maybe you have a specialist like a cardiologist that you see 4 times a year. You have certain tests that you do every year, and of course that requires a doctor's visit to review the test. So let's just say on average 10 times a year. Remember, if you move to Plan N, you have that $20 doctor office copay. So $20 times 10 is $200. If you're saving $400 a year, but you have to pay $200, is it worth it? So, some people say yes, some people say no. Remember, you also have that $50 copay for outpatient emergency. So that's another factor. Most people don't plan on going to ER, but that could be an additional cost. And last but not least, does your doctor take Medicare assignment? So those are the things you need to look at. When would you consider the difference, and when should you shop? Well, clearly, when you're in your initial enrollment period, your IEP. That's when you turn 65 and sign up for Medicare and enroll in a supplement for the first time. Or you could be retiring over 65 and enrolling in Medicare Part B for the first time. And oh, by the way, in either of those examples, when you enroll in Medicare Part B at 65 or older, it's a federal law. You have a 6-month open enrollment period when you can buy a Medicare supplement, no questions asked. It's what we call guaranteed issue. They cannot decline you. They cannot ask you medical questions. They can ask you smoker, non-smoker, but they cannot decline you. Outside of that initial period, it is not guaranteed issue. So the other time you would shop would be outside of your initial period. And by the way, Medicare supplements are not a Medicare program. Medicare is ABCD through the government. A Medicare supplement is supplemental insurance that picks up where Medicare leaves off. So it is not a guaranteed issue product that you can shop during the annual Medicare open enrollment that happens every fall. You can shop a Medicare supplement all year round. And when most people do that is when they get rate increases, because these premiums go up every year. So you don't want to shop every year, but if you get a significant increase, and some people have been on a supplement for 10 years, and guess what? The price of everything is going up. So now they're looking to shop. You'll want to talk to a broker, and because it's not guaranteed issue. And so you need to find out, can I go through underwriting? Can I switch to another company? Now, there are some states that have guaranteed issue products. We have one in Illinois that you can buy anytime. The question is there premium savings to move to that? The second thing is that some states have passed birthday rules, and they vary by state. So in the state of Illinois, we passed a birthday rule that lets you, within the same company, XYZ company, move from one plan to a lesser plan near your birthday, guaranteed issue. So you can literally go from G to N, no questions asked, if your health is an issue and you're not going to go through underwriting. So you'll want to talk to a broker and see if you can do that. Now, if you're under 65, your initial enrollment period is when you're eligible for Medicare the first time. And the same thing applies. You have a 6-month window to buy a policy guaranteed issue. But somebody under 65 has a second IEP when they turn 65. So you have the opportunity to shop guaranteed issue, no questions asked, a second time in your life. Now, why would you do this? Maybe at age 40 or 45, whenever you qualify for Medicare, you buy a cheaper plan. Plan N is not as rich of a, because you're trying to save money. But when you turn 65, those premiums go down. It behooves you to shop, and you might want to buy the better policy, Plan G, and see which carrier is the best at that time, because who knows? We don't have a crystal ball, and they change their rates every year. So that's another time to shop. Now, Plan G versus Plan N, which is best? Well, we know for a fact that Plan G is considered the, quote, best plan. It has the richest benefits. Currently, Plan N is a money-saving option, but when you save money, you're giving up some benefits. So the question is, are the lower benefits worth the premium savings? And that's really up to you. If you want to shop, call a broker in your state, or you can go to our website, cbhealthins.com. Under the Medicare tab, there is a little shop for, I had it up here, maybe not. There we go. Shop for Medicare plans. We do have a little button there that you can click, and we will help you shop if you're interested. Until next time, thanks for watching. This is Kathy Bukowski, the owner of CB Health Insurance.